I'm called Nakasita Catherine. I'm a Senior Assistant Nursing Officer, Palliative Care. I work with Kitagata District Hospital, and I'm the focal person Palliative Care in Shema District. The role of palliative care in the holistic approach of patients living with cancer looks at the overall definition of palliative care. Palliative care is the holistic approach of care that aims at improving the quality of life of patients and their families facing challenges of life-limiting illnesses. The holistic approach comes in where we have to assess the physical needs of the patient, the emotional needs of the patient, the psychological and the social issues that affect the patient, and the spiritual aspects that affect the patient. So the holistic approach of care encompasses all the 4 dimensions. Under the physical aspects of care, we are looking at the physical pain. We want to reduce the pain that this child is going through. And under the physical aspect, we look at the symptoms that are affecting the child. That could be the nausea, maybe the child has presented with cough, maybe the child has presented with vomiting. So we are doing symptom management, and we are also controlling the pain to enable the child live a quality of life that that they would wish to live. Under the emotional, we are looking at counseling the patient and the family. We have to come in with coping strategies to enable them be able to thrive despite the illness they are facing. The social, we are looking at how best can we support the children and the family. What are those social needs that that are affecting their ability to receive care? Spiritual. These people are prayerful. Maybe they are Catholics, maybe they are Muslims, maybe they are Anglican, and the illness and the concept of treatment affects their ability to be able to receive spiritual care. So once in a while, we bring in people to pray for them. We allow them, join communities where they are able to receive spiritual support. So the holistic approach of care looks at controlling the physical pain, but it's not only the physical pain that affects this child and the family. Under the emotional, social, and psychological, we bring in the patients and their families, because if one patient has cancer, everyone in the family is being affected. So how best can we help the family be able to to continue looking after this patient, be able to reduce on their stress in the continuum of care? So everyone has to come on board so that they understand the condition, they live with the condition, but at the end of it all, they are able to live an improved quality of life. So children and family facing challenges of life-limiting illnesses have very many complexities that they go through. They have issues with transport, they have issues with family involvement and support, where we've had some of the children being abandoned. They have issues with adhering to their appointment dates. When they reach hospital, they also have challenges of getting the medicines, because most of them are out of stock, long queues, long hospital stay. As a palliative care nurse, we come in to look for funding. We tap in the already existing charity organizations where we link these patients. Sometimes we refer them to mobile hospice in Bara if there is a chance. Then the Rotarians, there are very many people out here who are able to support these children, especially with transportation. We also refer them to social workers who come in, to counsel them, and the counseling helps them to adhere to their treatment. We've also written proposals where we've asked for funding, especially during COVID-19, where some of the children were unable to continue with care because of, the halt in transport. So we wrote proposals where people of goodwill were able to support these children. Politicians came in and supported children with transport. The Palliative Care Association of Uganda also came in to assist children to be able to receive their care. We've looked at family involvement and support. This one helps us, to enable all the children to continue with care so that we stop the risk of children being abandoned. So the families come in, we sit with them, we counsel them, and we tell them, despite the illness, the children are able to thrive because, most of these cancers in children heal. So we encourage them to continue receiving treatment, but that one is done through counseling. So we've also looked at, how best can we support these children while they are in hospital. Those who stay for a long time, we've connected them to hostels where they are supported with meals, they are supported with transport to come to hospital. Like here at Kitagata Hospital, the medical superintendent has been really helpful. The children who come here for symptom management, he has provided eats, he has provided tea, and he has also provided transport to take children back home or to hospital for review. Yeah. The communities have been very helpful. The community healthcare workers, those are the community volunteers, they've helped us to visit the children that are in their localities. They visit them, they help them with housework, you know, they help them in, you know, adhering to their chemotherapy drugs. They help them in, you know, in taking them to nearby hospitals. They provided the mosquito nets. They provided the essential drugs, you know, to help them be able to live an improved quality of life. The community has also been helpful in, you know, calling on the spiritual leaders to come and pray for these children while at home. They've also helped in advocating for the rights of these children, you know, and that has helped them, you know, to stop the stigma. And we have the disease, it's okay, we have the disease, but, you know, we can continue like any other person. Maybe we can continue with school, we can continue playing with other children. So the community has really been helpful. They visit, they do those cultural and traditional rituals, you know, that happen in their society, and these children are invited. So they take them as part of their community, and that has helped to stop the stigma. So the families have really been supportive. The families come in and help us in scheduling the appointment dates for these children. When we tell them, you know, come for review after 1 month or 2 months, so it's the family that, you know, has to track the date and the time when they're supposed to come to hospital. They've provided children with nutritious meals. They've been able, I mean, to grow vegetables, to grow, you know, the local things that they can get in their capacity, and they've been able to provide to these children. But most importantly, they help us in bringing the children for review. And, you know, this loss to follow up, this abandonment has reduced because the families have come on board to discuss with us, and, you know, they've all understood the importance of continuing with care for these children. And the families have also tapped in the existing, you know, charitable organizations where they go and seek for help, especially in churches. Some children sometimes are referred to Mulago, and they go into their community faith, and they solicit for funds to help them while they are in Mulago receiving radiotherapy. So the families have really been so supportive. And they also counsel. They also help us in counseling their children, counseling. They also connect with other people who are suffering from the same illnesses, sit down, share experiences that have enabled them to cope with the challenges they are facing. This one has been done through multidisciplinary approach, where we work with a variety of people. We work with pediatric oncologists. We work with the social workers, maybe like at Mbara Hospital. We work with people who have more expertise in palliative care, like the staffs at Mobile Hospice in Mbara. We've also worked with political leaders like the district. So it's the interdisciplinary approach that helps us, you know, to provide care for these children. So collaborating with those people has really enabled us, you know, to go far in providing care for these children. Palliative care, since it incorporates the holistic approach of care, where we look at the physical pain, you know, the symptoms that these children go through after receiving their drugs, emotionally, how are these children, you know, after this treatment, the community they stay in, how does it impact their well-being. So palliative care comes in to control the pain, where we've given children opioids, non-opioids, adjuvants, you know, to enable them have reduced pain so that they are able to live an improved quality of life. We've assessed for symptoms such as nausea, such as vomiting, fatigue, cough, where we've given antibiotics. Emotionally, we've counseled these patients. the psychosocial support, where we call in social workers and other people in the communities, the community health workers, to counsel the families so that, they are able to remain on track and, bring these children to hospital. Spiritually, we've called in people of their faith. If they are Muslims, they are sheikhs. If they are Catholics, the priests. If they are Anglicans, they are reverend, to come and pray for them. They also have these small groups of the charismatic. For the Catholics, they come here maybe when they're in hospital and they pray for them. So the holistic approach of care is really very fundamental in helping these children. Special hearts for every child, in brackets, the Shine Project. It's a project that started way back during COVID times. It started way back in 2020, and we started by a child. That child was 5 years and he had cancer of the ear. The child was living far from this hospital. But, during that halt of transport, this child was supposed to go back to Mbara to receive chemotherapy. But when transport was halted, they were unable to go to hospital. The child was unable to go to hospital, and the family was unable also to support the child. Remember, the father and the mother were not working, so there was no food in the house, and that brought in violence to the ladies. So the child deteriorated, the pus in the ear started, dripping, and the whole house was really stinking, and flies from all over had to surround the child. So it was one morning when the husband chased the lady to go away with the child. So the woman carried his son on the back up to Kitagata Hospital. On reaching the gate, they were spotted by our hospital driver, who saw a lady carrying a child, and the child is full of flies. So the driver asked the lady, what's this? Why do you come here? Then the lady said, my child is suffering from cancer, and the lady broke down and cried. So the driver told them that, you'll be supported here. The child was admitted on pediatric ward for 1 week, received antibiotics, and when the child improved, the child was sent to Mbara Hospital using the hospital ambulance to receive chemotherapy. So many other parents started carrying their children, especially those who had cancer, to this hospital. So it was too much for the medical superintendent. So he asked me, what can we do? So I said, maybe let me write to the Palliative Care Association of Uganda. So I wrote and explained and took pictures of the child. And the Palliative Care Association of Uganda came in to assist us in providing transport to Mbara Hospital. So that's how the Shine Project was introduced to this hospital. So later, the staff from Palliative Care Association of Uganda had to meet the district officials, the CAO, the chairman LC5, and the district health officer. After they came here and talked to the medical superintendent, and that laid the foundation of the Shine Project. So Shine Project has like 3 objectives. We are looking at providing transport for these children to go to hospital, to Mbara Hospital majorly, but also to have their symptoms controlled in healthy center 4s in their region. So they go to Nsika Healthy Center 4 in Buhweju, those in Buhweju. They go to Rubirizi, Lugazi Healthy Center 4 in Rubirizi district. Those in Shema, the other side, they go to Kabohe. Others, those near Kitagata Hospital, come here for symptom management. So we also look at the emotional and psychosocial support for the children and their caretakers while in hospital, where we counsel them, and that has helped them to continue bringing the children for treatment. And we've also provided other basic needs, like for the long stay in hospital, we've provided them with food, and we've helped them do investigations that are very important before they receive the chemotherapy treatment. So that's what Shine does. As I said, palliative care is the holistic approach of care that aims at improving the quality of life of patients and their families facing challenges of life-limiting illnesses. But this is done through early identification. If a patient is living with a chronic illness, we have to know this early. So early identification and impeccable assessment, we assess the physical, the emotional, the psychological, and spiritual aspects that affect this patient, and we do the management. And the management is also done holistically. So people out there should know that palliative care is a right. Everyone has a right to live an improved quality of life. We should live well to be able to continue doing activities of daily living. So let people come to hospital, let people seek care early. People can do daily checkup or monthly checkup. Once in a while, go to hospital, do your blood pressure, do blood tests and see if you're really physically or emotionally fit. And when you find yourself that, you've been diagnosed with diabetes, you've been diagnosed with hypertension, you've been diagnosed with liver or renal disease, come to hospital early, because that's what I said, early identification. We get to know the disease early so that you start care as soon as possible. So when you start care as soon as possible, your quality of life will definitely improve.